Assalamu alaikum, Dr. Arshad Mahmood here. So in this video we'll discuss about the nocturnal enuresis, that is also called as bedwetting, where a kid will pass urine while sleeping, and we'll discuss that what is it, what is the pathophysiology underlying it, and what options we have for the management of this condition. So normally at the age of 3 years, most of the kids will get the control, both of fecal control as well as control on urination. However, in some kids, this phenomena of nocturnal enuresis or bedwetting continues. Mostly in these cases, you will get the family history that the father or mother of the kid will also had this problem in during their childhood. So in this condition, this is not an alarming condition. It is very common condition, and most of the kids get rid of it before the age of 5 years. So what are the alarming or red flags in case of bedwetting or nocturnal enuresis? If the kid is having diurnal symptoms, meaning that the kid is also having unable to control the urine during the daytime, he wets his pants during the daytime, then that is an alarming system sign. That can be because of some abnormalities in the urinary tract pathway in malformation. Second is that if your kid is getting is losing his weight, if the kid is having increased appetite and polyuria, so that can be some issues with the issues like diabetes that needs evaluation. Similarly, if a kid is having burning micturition, is passing blood in urine or pus in urine, that also need evaluation. It is not a normal nocturnal enuresis or bedwetting. Patient can have UTI. Other is the constipation. In severe constipation, patient can also again have this phenomena of nocturnal enuresis. So you have to ask the patient on history and as well as evaluate for the chronic constipation. Another important etiology in bedwetting and nocturnal enuresis is the adenoids. The adenoids will lead to breathing problem at night, and also these patients can have the nocturnal enuresis. While taking history of nocturnal enuresis, you have to evaluate for the any psychosocial stressor, child abuse, any child abuse. That is very important, except especially in those cases where child initially had attained a normal nighttime control but now has passing urine at the night. So in that cases, psychosocial stressor as well as the history of child abuse is very important. So we do not go for any treatment if patient is fine and all these things that I have mentioned are not present. We will usually wait till the age of 6 years. Till then, you can advise some measures like reducing the evening time intake of fluids, caffeine, and also taking patient to the washroom before sleep. And even you can before when you are going to sleep late night, then you can take again kid to the washroom. You can also use the pampers, and sportive management is done till the age of 6 years. After 6 years, the treatment is recommended, and the choice of treatment, the different treatment options are there, like the belt alarm therapy, but availability in Pakistan is an issue. And the drugs, the first line of drug are most effective drug is the desmopressin, that comes in usually in the form of mineral and a tablet of 1 mg, and we started with a 0.2 mg tablet at the bedtime, about at bedtime 2 hours before going to sleep. And also the important thing is that you will restrict the fluid 1 hour before and after the taking drug, because it can lead to accumulation of fluid and hyponatremia and raise intracranial pressure and other complications. So you can increase the dose if response is not there twice a weekly to the 0.6 mg per OD dose. Other drugs like tricyclic antidepressant like imipramine can also be used, and in cases where you're suspecting some overactive bladder, oxybutynin can also be used. Thank you for watching the video.